Great. All right, so I'm going to get started. Somebody put something in the chat. Let me just double check. Would prefer 6 p.m. That's great. So welcome everybody. I was just saying that we had a morning meeting as well, which don't worry if you missed it, because this is an exact version of that. Although in the morning we had Vanita, and today we've got Suzanne Foley, who is the lead in public health in Slough. So what she doesn't know about COVID-19, nobody will know in the country, to be honest with you.
No pressure.
No pressure. We had about 38 people in the morning, and we've got 22 today. So there seems to be a preference for the morning, but it probably makes sense for us to do both morning and evening at 6 p.m. because different people can come to different things. So this is either the second Zoom meeting that we have, or the third one if you count the one in the morning. But because they're the same, I'm just going to say it's the second one that we're doing, and we are looking for feedback from you guys as well. One of the places that you can go to get more information is going to be the oneslough.org.uk place where you registered as a community champion. It's now got frequently asked questions, so you can put questions in there and public health will then give you the answers to that. And a great part of that process has been, people are saying to me, you know, I've got people that speak Urdu, people that speak Punjabi. There is a translate button on there, so you can look at the questions and they'll get translated into the different languages, including Polish, and people that want to read it in that particular way can also get access to the detailed information. And what's a OneSlough champion? In the end, really, it comes down to three fundamental things. Is we invite public health to come here and give you information, and you learn that information. Then you impart that information to your friends and family, hopefully to influence them so that they will understand the rules and stay safe during that process. I think you've got a very, very important role, really. Some of you will understand this, but you know, when my mother was ill, I would absolutely make sure she took the medicine and took it at the right time and in the right manner. Yet when I was ill, I was kind of less serious about it, and there were times when I forgot to take the medicine, and sometimes I'd have left over because I didn't take the complete course. And we tend to be people that will take care of our family and our friends and sometimes our community far more effectively than we will ourselves. And I'm hoping that you will all become passionate about taking some of the key messages that come out today and impart them to your mum, your dad, to your friends, to your children, and to the community and neighbours that you have around you. And that makes a very powerful influence. And we will be able to keep Slough safe in that manner. So I'm going to go to the next slide, if that's possible. So please mute your microphone during this period when you're listening. Just to let you know, it is being recorded. So if you don't want yourself to be recorded, you can put your camera off. Feel free to ask questions, not through the microphone, but through the chat phone. Currently, Tim and I will collect those and ask any of our experts here to answer those questions for you at the end. And enjoy and have fun. Next slide. So we've got a packed agenda. We'll get you up to date on what's been happening since the last Zoom meeting. We have gone through tier 2, and Sue will explain exactly what that means in terms of the new rules and answer any questions later on. We've got a COVID dashboard for you to look at, which you can also check independently yourself. Tim will talk about some of the insights that are happening, and at the end, a feedback and Q&A session for everybody. Next slide. I just wanted to highlight, some of you may not be aware, there's a lot of charities and community groups also as part of OneSlough. This is by no means all of them. There's far more stuff happening, but the dozen or so that report back to us, they're helping over 1,500 people, which is amazing. And in September alone, 158 parcels of food were delivered, 644 prescriptions were picked up and delivered to people's homes. The type of clients that we're supporting, there's 478 that were vulnerable adults who are 70 plus, 399 with learning disabilities, and we also got families with children where we may have single parents and people that are at risk that we're making sure get support that they needed. Next slide, please. I want to thank everybody who's involved in that kind of support, but I also want to thank you as community champions for attending today and being committed to take these messages out to the world outside and keeping everybody safe. Next slide. So we're going to start off with a bit of participation exercise of a poll. We've got some questions for you. We've got 3 questions, so get ready to answer these. And you can answer these and then we'll present the answers to everybody. The first question is, if a vaccine for COVID-19 were available today, would you take it? Is that yes, no, or maybe? And you can click on the right answers. I'll do it. Last time I forgot to do mine. This time I'm going to do mine. And the second question is, have you had your flu jab this year? Yes, no, not yet, but I'm planning to. And some of you might have. I tried to get one and had to wait a week, but eventually got one. And finally, the question is, how has COVID-19 impacted you? You know, going back to March for the last 6-7 months, how's it impacted you? Now you can click as many as you like. So for instance, I know that I had a few sleepless nights and my anxiety level went up, but you know, how did it impact everybody else? Did you start under eating? Did you start overeating? Did you get more exercise? Did you get less exercise? Did you start to drink more? Did you start to drink less? Or did none of the above apply, or you'd prefer not to answer? And then you could submit at the end, and then that will disappear, and James in the background will be collecting all the answers. So we've got 26 people. James, how many people have answered so far?
We've got 23 out of 24 people, and I think I'm probably the 24th, so that's probably it.
Okay. So will you show us and reveal what the answers from the audience are? If a COVID vaccine was available, 70% would say yes, but 26% would say no. Sue, are you surprised at that in any way?
It depends. I suppose it depends as to whether they thought that maybe the vaccine were available at the moment. Had it been trialed enough? Had it been looked at enough or done too quickly to be available at the moment? Maybe just people are not quite sure what it would entail. I know with the flu vaccine, people are worried about the gelatin content. So maybe it's just concerns around that. But it'd be interesting to know why the no's are there.
We can do a further survey later on through emails and through with the 500 with all of the community champions. But I know that it's useful to know that there are people that what information would make a bigger difference for them to say yes.
Yeah, that would be really helpful. Yeah.
How has COVID-19 impacted you? Again, Tim and Sue, are you surprised at any of the answers? Insomnia is at 40%, which I've heard from a lot of people. Anxiety has been the highest answer when I've done this thing previously as well with the people. Overeating, which is probably me, 48%. Under-exercising, 57%.
Yeah,
this is
not much of a surprise, certainly with the anxiety, I think, as well, because of all the uncertainty, isn't it, about COVID and what's going to happen, what may happen, how it's affected families and the community. Yeah, no surprise there.
Yeah, so we're also working as a community with Ketan from Slough Borough Council and looking at what services we might need to provide over the next 6 months around anxiety and loneliness and isolation. And we'll come back later with more support services on that. So I'll close that and we'll go to the next slide. Which I think is, so I would like to now invite Suzanne or Sue, all right, who's the consultant in public health in Slough, to take over and present to us.
Okay, thanks, Ramesh. Evening, everybody. Fantastic to see so many people here on the evening call. Apologies if you hear any kids in the background. My children have just come back from nursery, so hopefully won't burst in on me a la BBC, but fingers crossed anyway. So just to say, yeah, obviously since the last meeting, coronavirus continues its rise within the borough. Our cases are rising, have been rising since around August, September. The concerning rise is within older adults, actually, that we're looking at. It used to be with younger people, and that's still a concern, but it's rising more in older adults, and obviously they tend to be worst affected by COVID. So that's something we are concerned about. And our rates now over 160 per 100,000. It is the highest in Berkshire. It's more aligned with what's happening in London. I know a lot of our population do travel into London and have family there. So, yep, we are concerned that it's now at a higher level, hence why we went into tier 2. And just to say, the current trend of new cases, as it says, representative of the overall demographic of the town. So there's no particular community group or area or geographic location that is standing out. It's just widespread across the whole town, basically. So all groups just need to be vigilant and just need to be aware that it's everywhere is a concern. Okay, next slide, please. Okay, so yep, we are now in tier 2. Obviously, went in 1 minute past midnight on Saturday. So yeah, there's just obviously the number of restrictions we have has gone up, and I'll go through those in the next slide, I think. But yeah, we're on COVID alert level high. Next slide. Okay, so here we go, the new rules. Right, so the main one, particularly for Slough, because we are finding that household mixing is one of the main issues that we have for cases going up, is that under the new rules, there's no socialising with other people in any indoor place. This does mean, we talk about household mixing, but it means people you live with, basically, that you are allowed to obviously socialise with, but not people from other places visiting your house. It means unless you live with them, of course, or formed a social bubble with them, a support bubble. So a support bubble is where if someone who lives alone, lone parents, single mum or dad, lone adults, then it was concerned that they were quite socially isolated at the beginning. So they were allowed to form support bubbles with another household, just to make sure that obviously their level of isolation could have been pretty high. So it was to make sure that they were okay and could actually interact with another household. So that's what a support bubble is. So that can continue, but it means that other households, other families can't come and visit yourself in your house. This is one of the main issues to trying to get across to Slough residents, because there's not a lot of families who don't actually live with you. So this is one of the main things to get across. Unfortunately, in tier 2, unless you're in this support, that can't actually happen. So for socializing outdoors, that's okay, but in groups of no more than 6. That does include children, I'm afraid, for England. So yeah, socializing outdoors, okay, but no more than six people in a group. The focus is to continue working from home where you can. That's still being definitely enforced. And yep, it's the hands, face and space basic basic principles: washing hands for more than 20 seconds, wearing a face mask, certainly indoors, and just keeping that space between people, at least 2 meters if you can. And obviously, if you do have symptoms, then get a test as soon as you can. Luckily, hopefully, the testing system has much more capacity at the moment. So hopefully, getting a test is far easier and better than it has been in previous months. So we're working hard to making sure that testing is available for the whole of Slough, certainly mostly at Monton, but there are other options. So, yep, when you're symptomatic, you need to get a test. Whilst you're waiting for the test to actually self-isolate until you get the test results. And then if you test positive or you're contacted by Test and Trace, then to follow their instructions and to identify which contacts you have had. So, yep, for your champions, yeah, just about promoting these Tier 2 restrictions to all of your contacts, networks on social media, particularly the one about no socialising with other people in any indoor space, because that's a really important one for Slough. Next slide, please. Now, if you do need, a hard copy of all this and any translation, then we can provide this. So don't worry, because I know it's an awful lot of information. So we do provide hard copy translation for if you need it. So the important messages are, yeah, just keep on protecting each other, protecting your family, community, hands, face and space, just those basic messages about washing your hands for 20 seconds, wearing a face mask when you're especially indoors, but also outdoors if you're required to or you want to, and keeping that space between each other as far as you can, at least 2 meters. So next slide. Ooh, here we are. So this is called the COVID dashboard, and you can see the web page there. It's still under construction, but it's hoping to be fully in place by early November. And basically, it just will have that information that people are looking for how many cases we have, what's the rate, latest rate in Slough, but also in other areas in Berkshire. So it will just give that information that people really want to see what's the current situation in Slough, basically. So that will be really useful, I think, for just people just to have that information about what the current situation is, and just to give an update, and it will keep updating as well as we get the information in. And we do want some feedback as to whether it's useful or what other information we can have on there. Obviously, there's some information that can't be put on there in the public domain, but as far as we can, we'll put as much information on there as we can to keep the public fully informed. So the web page is there. So if you want to spread the information as far as you can, then that would be great, because we can direct people to this website to provide the information. And I think that's me. And there's been lots of chat on, which is fantastic. So yeah. So it is early November for that website being up and running. It looks like it's Wednesday, the 4th of November. There's been on the chat. So yeah, after then it would be brilliant if you could spread the word about that dashboard. Thank you very much.
So there's a question from Susan Webb, which is regarding numbers for Slough. Are people who have had a test at Monton and people in Western Park, both of which may include many who weren't actually Slough residents? So in terms of the figures, is it based on where they take the test, or is it based on where they live?
For positive cases, it is where they live. For the actual tests at Monton, then we can get, obviously, if they've had a test but don't live there, we may get those results. But for the rate and for the positive cases, then it is Slough residents that we get the information from.
Okay. We had another question, which was this morning, which I think is relevant for today, is can I travel to Windsor, which is a Tier 1 area from Slough, which is the tier 2 area, and what then rules apply?
This is a tricky one. It's a very good question because we haven't had discussion with the consultants about this one. So the premise is that you as an individual take the restrictions that are in your area if you're traveling to another area. So under tier 2, if you're traveling to Windsor, you still should not mix indoors with another household unless you were in that support bubble. And then you still can't meet outside in groups greater than 6, but I think that's everywhere anyway. And also about it also pertains to meeting in restaurants as well, and for businesses. So the premise is that you take the restrictions in your area when traveling to another area, which I know sounds very difficult because you just think, well, I'm traveling to tier 1, so that's fine. So surely I can just be tier 1. But the thought is that the risk is in the areas, then it's in the individual as well. So it would be the individual's responsibility to take the tier 2 restrictions to wherever you're traveling to. And unfortunately, that also, if you're traveling to a tier 3 area, which technically you shouldn't do, but if you do have to, then you have to abide by the tier 3 restrictions in that area. Though it's unlikely you'd be traveling to tier 3, I wouldn't have thought so, but just in case, then you'd have to adhere to the tier 3 restrictions. I know it's a bit confusing, but that's the idea. You carry the restrictions in your area to wherever you're traveling to. Unless it's a higher area, then it's those restrictions that you have to follow. I hope that makes sense. I know it's very difficult to try and follow all the ins and outs of it, but that's the premise. Hope that makes sense.
Yeah. I've got another question, which is around kind of, I suppose, performance space or faith space that we had in the morning question, which is, I'm a performer who is storytelling in Reading. It's mainly outdoors, but sometimes when it rains, I go inside. So how does that work for me? How many people, I suppose, that can they mix with if it's indoors and they're doing the storytelling session?
That's a tricky one because there are some businesses that are exempt. So you need to just check whether your business is exempt from the restrictions of large gatherings. So I'd have a look on the government website as to whether your business is exempt. Unfortunately, it tends to be if you're moving indoors, then the groups of 6 and the non-mixing of households does still apply. But I would double check for your business for that on the government website.
Okay. So before I move on to Tim, there might be 1 or 2 shy people. I know that I've got Shin Dotha in the audience. Shin is from Slough Outreach, and he's been feeding most of the homeless, not just in Slough, but I believe in other areas sometimes as well. And currently now he's feeding school children that might need support. Don't know whether you got any questions in terms of the fact that you're out and about quite a lot and meeting people and as a charity worker serving quite a lot of people.
Hello everyone, hope you can hear me. Thanks for the invite. Sorry I joined a little bit late, but I've got to leave. My job is to coordinate most of these groups. So like today, I think Salvation Army is closed now because they had a positive case for the next 2 weeks. So Thursday session and Sunday sessions we're taking on as well to go out and serve those in need. And but we have different groups. They're all in their little bubbles. And my main job is to coordinate. And in Windsor, there's obviously a few groups that go out. Maidenhead, we've got a group that operates there. We don't have to travel to those groups, to those areas, sorry. I mainly stick to Slough, and volunteers, wherever they are, they stick to their areas and look after their own in their sport groups in those. So at the moment we're operating out of Slough and Eton College School, and from tomorrow, good news, we got the Langley College back, so it's going to be another drop-off point, and we've had quite big positive response from the whole of the community in Slough, businesses and everything, they're all offering drop-off points. And I think we need to have I had a call with Ramesh the other day when I said, look, we're getting so much response and we get so many donations that we just need to get this coordinated a bit better. So yeah, sorry I haven't been on this call. Just I found I'm a bit, I'm always busy, but I'm behind you guys, and we'll work together with and follow the guidelines that you set out.
So Harja, who does know about your work, says, Shin, you're doing an amazing job. Well done.
Yeah, thank you. Appreciate that. You guys carry on, and we're coordinating, and we'll carry on what we're doing. We're good at what we do.
So, Sue, I've got one final question, which I think I may know what the answer is. But so we answered if we're going from tier 2, like Slough to Windsor. But what about a Windsor person coming into Slough from tier 1 to a tier 2 area? I'm assuming they would then have to operate to the rules of tier 2, would they?
Yes, that's right. Yeah. So going to a higher tier, you have to operate by the higher tier rules, I'm afraid. Yeah. Yeah.
Okay. I have got a question from Jo Gumps, and she says she joined a bit late. But I have children. I have concerns over my children being at school and bringing a virus home to us. Now we're in tier 2. What measure will all schools have to take, and will we have the option to keep them at home? I don't know whether you know the answer to that, or whether I have to give it later on.
Okay. So for schools, they've already got measures, an awful lot of measures in place around social distancing, around bubbles in schools to try and minimise the amount of contact there are between pupils and also between the teachers. I recognise for schools, primary schools, it may be easier. For secondary schools, because of the nature of GCSEs and A levels, it may be a bit more difficult. But yeah, schools are for going into tier 2. There's slightly more restricted, I think, around face mask wearing, a bit more of that. But because they've already got the system in place with their bubbles and the risk assessment, then there's not a lot more moving into tier 2 that they can do. The premises around schools is that children themselves are at very low risk of any bad outcomes from COVID. Obviously, the risk is them possibly bringing something home, but because there's high vigilance around symptoms, not having people coming in with symptoms, moving fast if there is a single case, contact tracing, working with Department for Education and the Public Health England. I know there's really good work going on, and also with our schools team as well. So there are very good measures in place to try and minimise the risk to pupils, teachers, and bring in any virus home. I'd say for keeping them home, obviously we want children to have best education they can, and so with the risk assessment, it is felt that that what's being done is enough to have children at school, minimise the risk, and just make sure they have their education, which of course is extremely important. So I hope that's answered your question. There's just measures in place.
Thank you. I'm going to move on to Tim for the next slide and for the next session.
Perfect.
Tim, take it away.
Great, thanks Ramesh, thanks Sue. So the next couple of slides, I'm going to present on a kind of opportunity for us all to help shape the local COVID response, and hopefully help us reach different communities that we haven't been able to reach before with communication. So this is based on a piece of work that's going on by the Berkshire Shared Public Health team. And the Berkshire team, they're there to support every local authority and the public health team across Berkshire. The piece of work that they're doing specifically is looking at where maybe we've got segments of the population which haven't been able to follow the rules, or haven't followed specific guidelines, or don't quite understand the rules, and whether that's the rules about hands, face and space, whether it's about the rule of 6, social distancing, isolation, etc. but also the communities that have got higher rates of COVID and higher rates of infection. This piece of work crucially has been looking back over the past sort of 7 months to really look at and understand where we've seen communities that have been disproportionately impacted on. And going forwards, we want to better understand some of the challenges that we face. So those two groups come down to what's called Group ABC, which I'm going to touch on in a bit more detail in a second, and Group D, which is ethnic minority subset across all ages. And I'm going to go into detail of that in a second. So what we're trying to look at as part of this piece of work is how we can present a kind of fresh, kind of tailored approach to rapidly engage with those groups and hopefully bring down our rates of infection. Next slide, please. So I'm not going to go into all the detail on this slide. This was just to show you kind of a really useful and interesting statement from the WHO's Regional Director for Europe. And it was really summarizing what we call information fatigue and what we talk about in the professional world of coronavirus fatigue. I think everyone's experienced this to some extent. You know, we spent 8 or 9 months of our lives dedicated to talking about this and dealing with this, and people have made huge sacrifices with the virus. So it's really fundamentally important that we look at different strategies that will get us back on track with our communities at the heart. And crucially, what we want to try and do is understand public opinion and you know, acknowledge the hardship that people have been through, involve communities in discussion, and that's a big role of the community champions and why you're here. And then effectively try and create a pathway so people are able to live their lives, but whilst reducing the risk of coronavirus and effectively protecting the most vulnerable amongst us. So next slide. So those two groups that I mentioned earlier. So the two groups that the research has shown that are particularly the challenge that we'd like to work with. The first one, Group ABC. So this is the British male, white male cohort, British male Caucasian, across 3 different age groups, which range from 18 up to about 64. And what we're really trying to understand with this group is, who are the influencers? Where do they go for the news? How do we get through to them? And what actually resonates with them? I've just noticed that Tessa, who's leading on this from the public health team in Berkshire, she's just mentioned this is actually the cohort is men and women across those age groups. The second group that we're looking at engaging with, which is Group D, this is our Black, Asian, minority ethnic groups, male and female, but those living in kind of one household but have family members that live in nearby households. So here, and for this group, it's specifically looking at where the challenges lie around the definition of household, the definition of a bubble, the rule of 6, and crucially, we're trying to find out who they listen to, who are their influences. And when we look at things like self-isolation, is that actually understood? Do people, and are we putting the messages out in the right language, in the right format, and at the right time? Next slide. So what we're trying to do with this piece of work, and this is effectively going to be a survey that will launch next week. We're trying to find out where these people go for their information. Who are their influences? What is the most effective channel to engage with those people? And how can we all affect a change in their behaviour? In other words, how can we get them to understand what a household is and what a bubble is? And through understanding and through listening and through that kind of research process, we'll get a better understanding of what's important to them and what's not important. And hopefully, the idea of this is that we'll create a campaign that will turn apathy into action. So next slide, please. So as a bit of a timeline and to give you an idea of what we're doing and what the plan of action is. Initially, we're looking at running a survey. The survey will launch at the beginning of part of next week, which will be providing more details in tomorrow's Community Champions email, and more details will follow next week. We'll then analyse all the data we get back from that to really kind of look at trends, to look at what resonates with people. And then we'll develop kind of a multi-channel creative platform, as it were, and a campaign to go out and test this with the residents. We'll then hopefully use those new messages and those new approaches to embed those into the subconscious minds of people, and what we're trying to achieve is behaviour change and obviously COVID compliance. So next slide. So what's the call to action? What are we asking of community champions? So like I said, this is going to go live next week. It's only going to be open for a week. So it gives us a very short time scale to engage with our groups and our resident groups. And what we're asking of people is to get out there. As soon as it goes live, we'll share this with you through the Community Champions email. And we want everyone to try and engage with their friends, family, relatives, their community groups, faith groups, anyone that they know that potentially comes under one of those kind of two groups, A, B, C, or Group D. And we're trying to target those people that might not understand the key rules, so things like the rule of 6, isolation, household, etc. Also, you'll be able to give us a chance to help us with translation. It will give you a chance to, we will give you a chance to feed back to us, to say, you know, what's working and what we need to do, whether we need to provide different things and different materials in different formats. So that's it. That's the social insights kind of research that's going to be going ahead. Like I said, we'll provide more details to champions over the coming days. Next slide, which I think is the last slide from me. Yep, this was just a reminder to everyone. We are continuing with our work around community preparedness. So we've talked about all the kind of the direct COVID things that we need to do to protect ourselves, but actually this forms part of our sort of future preparedness work. So in other words, what can we do that will support our immune systems over the winter and going into next year, which will give us the best chance of you know, leading a healthy winter, avoiding the worst outcomes with coronavirus. And this comes under our campaign called #FitToFightCovid. And this is trying to get people to understand the importance of healthy weight, the importance of physical activity, all in the light of COVID. So we know that those things are contributing towards worst outcomes from the virus. So we're continuing to roll out that campaign, and I'd just encourage everyone, if you can, please share those messages, share the hashtag, and help us reach as many people as we can with these really important messages. And I think the next slide is back over to Ramesh for questions and feedback.
Yep, Tim, that's both of us for any questions that people might have. Use the chat line or put your hand up, and because I think I can arrange it so I can see everybody, which hopefully I can. Yeah, and I know who's asking questions. One of the questions, which might be for either Sue or Tim, that came up earlier was, we've got bonfire night coming up on the 5th of November. We've got Halloween coming up even earlier before that. We've got Diwali sort of around the corner. What, now that we're in tier 2, does it change what we do or don't do around those festivals?
It does, I'm afraid. I know, because Diwali is a really family and community based festival. So with those, it's certainly the household mixing, the people you live with, non-mixing with other people, coming round for Diwali celebrations are rather curbed. There are messages that have gone out around these festivals. So for instance, if you're thinking of having a Diwali party or anything like that, then unfortunately this can only be with people from your support bubble, not from people from other houses. Certainly indoors. Outdoors, this could be done, but only in groups of up to 6, including children. So unfortunately for things like firework, bonfire night, Halloween, things are rather curbed in terms of outdoor celebrations, big gatherings, and also indoor community and extended family celebrations. But I think there are messages on our on our council pages around how to have a safer festival, certainly Diwali and other the bonfire nights, and messages have gone around how you can perhaps think about how differently you can perhaps do trick or treating for children, perhaps on an online basis rather than actually going around houses. So yes, things are a bit curbed for this year, but hopefully for next year, then we may be able to celebrate in a more fuller sense.
Yeah.
I don't know whether Tim's got anything further to add around that.
Yeah, no, I think you covered it. So I think it's going to be a challenging kind of 3 or 4 months, what with Christmas on the horizon and New Year. But I think that just highlights the importance of the fact, we are in tier 2. We don't want to go into tier 3. We want to, drive down our rates of infection. If we can do that, and if we can all work together to do that, then we'll have better outcomes over the winter.
Tarek has also put in the notes to say that we also got Eid today, so I'm assuming everything that you've just said applies to that as well. If anybody's got any questions, like I said, they can put it in the chat and I'll read them out, or if you want, raise your hand and I'll spot you. There is a reactions button on Zoom where you can clap or put your thumbs up. So use one of those and that will give me a clue that you might want to ask a question. I've got a question from a business really, which I answered previously. And I know that we got Shamila on the line. She runs a business, and it's similar to where I had the question, which is that being a therapist, I have clients that come and see me, and where I have to provide them with support, can I still carry on with the one-to-one support from a business?
I think hopefully you've had sort of measures in place for it. Is your business about speaking to people or actually providing hands-on therapy, so to speak?
Bit of both, I'm afraid.
Both, okay. I think there are certain businesses that are exempt if you're providing a kind of therapy service. So it's but good to look on the local government website as to whether that can still take place. It's mainly for businesses that are affected are mainly restaurants and bars because of the social mixing element of things. So other businesses should be able to continue as before, but it depends whether your business is part of that exempt element. And also whether you have different people coming in to mix. But it sounds like if it's one-to-one, then hopefully it should be less affected, I think, but worth checking.
Okay. We've had a couple of similar questions on online, which have been from people asking questions like, if I have a cleaner that comes around to my house, or if I have a childminder that comes around to my house, can they still come round? And there's no change in the rules as far as that's concerned, but just to re-emphasize the importance of when they are around, they have to wear a face covering. Obviously, you're advised to wear a face covering, social distancing, hand washing, that all still applies.
So we got a question from Kaz, which says, is there a projected end date for tier 2? What has to happen before, when we go back to tier 1 or normal?
That is a very good question, and I know at national level it's still being decided as to what criteria they're looking at. One for I think still for going up into tier 3, that's still being totally decided. But for coming out of tiers as well, coming back, that is still being discussed. I'm afraid we are pressing nationally for a definitive answer on that. But it's a very good question. Yeah.
And Harjit asks, do we know the infection rate in Slough? What rate would it mean that we go into tier 3?
Okay, so yeah, the infection rate we look at is the positive rate per 100,000. So that at the moment for Slough, that's around 160 per 100,000. And again, yeah, for tier 3, it's still not very clear as to what rate you have to kind of hit to go into tier 3, and there's also other areas that they look at, as I understand it, rather than just the rate. So we're, as I said, we're still waiting for a definitive answer nationally as to what would have to be, what thresholds would have to be hit, so to speak, to go into tier 3.
Okay. Maybe it's not clear, but what percentage of people show symptoms and not? I saw 65% of people don't know they have it. Is it true that people can have it and not know that they've got it?
Yes, yeah, that is true. It's it's called asymptomatic. I'm not sure the total percentage, but it is a quite high number of people who just don't display any symptoms at all, and obviously can still be infectious. So that's why the hands, face, and space basic guidance is so important, because that you may be in close proximity to someone who's just not showing any symptoms but may still be infectious. So hands, face, and space is just really needs to be emphasized because of that asymptomatic percentage.
Okay. Mohammed Qureshi is offering to translate some stuff into Urdu, Hindi, and Punjabi as well. And he's got a background in public health medicine.
Fantastic.
Just thank everybody for the OneSlough community sprint. And he's creating a video, just possibly for us to circulate around. I've got a question from Shamila. We have a detox clinic and we're being guided by the spa we are using, but we are in the local. But what are the local rules on one-to-one therapy? We have PPE for the therapists.
Is this a health clinic then? Health detox clinic?
It's a detox clinic. Yeah.
Clinic. Okay. Yeah, there should be guidelines that you're following. Yeah, certainly for PPE, and how you see people and how people come into your clinic. There's definite guidelines for that for detox clinics. If you need it, it sounds like you're following it anyway. So for moving into tier 2, there shouldn't be any change for your clinic if you're following the guidance that's available.
Yeah. We're getting, I think, kind of support messages from businesses saying we can help businesses to go online, charities to go online and services to go online, which is really good. You could send that detail to the OneSlough website as an information there, and then we can pick it up from your email and deal with or talk to you individually. Got a question, which how many residents with a positive COVID test are sick and hospitalised in Wexham Park Hospital? So it's to do with the hospital and how many people in there might have COVID-19.
Okay, so some data will be made available around hospitals that's coming out nationally that people should be able to access. At the moment, we can't give that information out, but there is some public information that will be made available around hospitals. Obviously, we are trying to keep a really close eye on the number of people who are going to hospital to make sure that hospitals aren't overwhelmed. So that's something we're keeping a very close eye on, particularly as the rate of cases in older people is increasing. So that's something we're definitely keeping an eye on with our NHS colleagues.
And a question that other people ask me, how really when we're socialising on the phone, is there evidence to suggest that if you had COVID, the antibodies will protect you, or is the jury still out? So if you've already had it, does that mean, hurrah, I'm going to be okay, or is it not very clear?
That's a very good question, because yeah, it's something that's been in the news from the beginning. Does having COVID give you immunity? Basically, I'm afraid the jury's still out. I think latest evidence that's coming up in the news is that antibodies do seem to tail off quite quickly. So I'm afraid the jury's still out as to whether COVID gives you immunity. I'd say at the moment it's looking less likely that it does. But as I said, the jury's still out. The eggheads are still looking into that one.
Can I just jump in as well, and just because we've had this question come through on the public health website and our social media platforms quite a lot about antibodies, and that antibody studies that have shown that only 5 to 10% of people have had the virus. One of the things that I always try and talk about as well is that the immune system is very complicated. It's a very complex system, and antibodies are only one part of the body's immune response to fighting viruses. The other things include things like T cells. So some of you may have, if you've been following the press, or if you've been following research quite closely, you've heard about T cells. And T cells are effectively another way that our body fights off viruses. So actually, what some of the emerging evidence is suggesting that actually the people that get sick and quite seriously sick will develop what's called the antibody response. Whereas a lot of people that have mild symptoms of coronavirus, maybe asymptomatically, or just have just sort of minimal symptoms, those people actually are fighting it through what's called T cell immunity. So there's quite a few different things at play, not just antibodies.
So I think, Tim, is that one of the reasons why you talk about being fit and healthy and other things when we're talking about COVID, because that's building up your immunity system, and that's just as important in today's world as not catching it. It is, if you do catch it, if your immunity is much stronger, then you're more likely to be able to fight that off.
Yeah, absolutely. I've presented and talked quite a lot about the impact that obesity has on the virus, inactivity, smoking. So all of these are other things that we can do to sort of change our general behaviour. Actually, all those things will help strengthen our immune system. And, if we do catch the virus, then it gives us the best chance of fighting off. So
where shall I go to find out more information if I'm stuck at home, which I am most of the time, and I need exercise, etc.? Are there any websites I can go to? Does the NHS help?
Yeah, absolutely. So first and the kind of number one place that I'll go would be the Public Health Slough website. So that's www.publichealthslough.co.uk. And that includes all of the services that are available to residents. We've got commission, we've got weight management services, we've got various different physical activity programs, we've got our smoking cessation support. Effectively everything that you might need from a health perspective, including mental health services, mental health support, etc. It's all available on our website. So we'll someone's just asked, but we'll share that after the Zoom meeting with people. Please feel free to use it.
Absolutely. We'll share the website so that you've got access to those resources if you need them in between. And then also please pass on those resources to your friends and family so that everybody can have as much access to it as possible. We're coming close to the end, and I'm not getting too many more questions other than sort of thank yous. Thanks for bringing everyone together. The residents might be interested in logging various sessions. So we will be having another Zoom meeting, I think, in about 2 weeks' time. Tim, we can sort of chat if no one needs to be earlier than that and what the topics would be. I don't know if anybody, Tim or Sue, you got some sort of final things that you might want to say?
Just thank you very much to everyone who's attended the chat and who's signed up for Community Champions. I think it's a fantastic program, and it's just a brilliant way for getting the community together, but also engaging and using the community to spread messages about COVID. And also what we want from yourselves as well is the feedback that you get from your networks as to how we can improve things and how we can make OneSlough just a better campaign and help the community. So just thank you very much for everyone, and yeah, if there's any more information you need, please contact us.
And I'm getting excellent presentations, easy to understand. Thank you. That's to Sue and to Tim in the way that they've been communicating what are essentially very complex messages. and I think everybody's appears to have found it very useful. So we will carry on doing this. And as Sue said, if you've got any suggestions on how we should communicate with you, or how we can make improvements, or how we can do things better, then please let us know. And you can go to the OneSlough.org.uk website, and you can send us an email from there to let us know how to improve things, or use the frequently asked questions to ask questions, and we can update you in between these sessions so that you stay safe. Okay, so if that's all, I'm going to say thank you very much, and see you next time.
Thanks, everyone.
Brilliant. Thank you. Thanks, everyone. See you again.
Thank you.
Have a great evening.
Thank you. Very useful. Thank you.
Bye-bye. Thank you.
Thank you. Bye.
Thank you, everybody.
Thank you, everyone. It was lovely. Bye.
Thank you.
Thank you, everyone.